When a swelling in the neck that moves with the deglutition, it is goiter unless otherwise proved, or it could be due to a thyroglossal cyst also. But for a pediatrician, for a surgeon, it is thyroglossal cyst unless otherwise proved. A midline neck swelling that moves with deglutition. But for a pediatrician, it's a nightmare. Is it a case of endemic iodine deficiency in which goit you have large goiter, or it could be due to a Hashimoto's thyroiditis, or a Graves' disease, or a late onset congenital disorder such as Dishormonogenesis that present that during that age group. There are so many differential diagnoses for a pediatrician. So when you see a goiter in a child, whether it is a puberty goiter that occurs during periods of adolescency, puberty age between 8 to 12 years or 8 to 13 years, in which there is an increase in demand leading to increase in the size of the goiter, size of your thyroid gland. If a child is brought with sweating, weight loss, exophthalmos, could it be a Graves' disease? I have seen a case of thyroid malignancy referred to me with the history of fever, weight loss, along with the x-ray showing miliary mottling. One cause for miliary mottling is thyroid malignancy. Or it could be due to the most common cause for goiter in the current era is Hashimoto's thyroiditis. And as I told you already, thyroid dysgenesis can present at birth or within 6 to 7 months of life. Whereas your dishormonogenesis due to deficiency of thyroid peroxidase can have its manifestations by about 5 to 6 years. So how do you know that you are dealing with a case of Hashimoto's, Graves, puberty goiter, dishormonogenesis, malignancy, etc.? How do you know? Let's decode each and everything in a very simple manner. First of all, let me tell you one thing. The most common cause for hypothyroidism, the most common cause for hypothyroidism presenting as goiter. I am not speaking about congenital goiter. I am speaking about goiter beyond one age of group. So most common cause is Hashimoto's thyroiditis. Very rarely it could be due to dishormonogenesis involving thyroid peroxidase or any enzymes involving T3, T4 production. Right now we don't see much iodine deficiency except in places of Himalayas or mountain terrains. And most common causes for hyperthyroidism is Graves unless otherwise proved. Even though we have transient hyperthyroid phase in Hashimoto's disease, transient hyperthyroidism that occurs in newborn born to Graves' mother. But by and large, the most common cause for hypothyroidism beyond 1 year of age group is Hashimoto's thyroiditis, rarely iodine deficiency. Do not miss dishormonogenesis. Hyperthyroidism, unless otherwise proved, is due to Graves' disease. Any child who is dull, not playful, poor scholastic performance, poor cold intolerance, more complaints more during November, December season. The child is short. You can have both delayed puberty as well as precocious puberty. Delayed puberty because thyroid hormones are necessary for gonadotropin action. Precocious puberty. Why precocious puberty? In long-standing untreated hypothyroidism, the alpha subunit of TSH and alpha subunit of FSH are one and the same. The most common presentation of hypothyroidism is poor scholastic performance, mild obesity, short stature, delayed puberty, pubertal, precocious puberty, and dry skin. These are all the causes for precocious puberty. These are all the manifestations of hypothyroidism. Rarely delayed dentition, and a short child, obese child with a dry skin, dull looking, along with the constipation, unless otherwise proved, is hypothyroid.